Hello everyone, bienvenue à toutes et à tous. Je m'appelle Sean Rourke et je serai maître de cérémonie aujourd'hui. My name is Sean Rourke and I'm a scientist at the MAP Center for Urban Health Solutions at St. Michael's Hospital in Toronto, and I'm scientific advisor to CANFAR, the Canadian Foundation for AIDS Research. I'm going to invite Margaret Kisika-Piasis from Canada to come up and say a few remarks. Margaret.
Nanaskaman, Meeto Wino Kechatasquio, Margaret Kisika-Piasis. I'm from Treaty 4 on this land called Canada, and I'm very delighted to be here today to speak and to say a few words. I honor the people from this land, from this nation that weren't asked to come and do the opening, and so I won't do an opening prayer here. This is not the land of my ancestors or the territory, but I will acknowledge them. And I asked for Pamasawan for life. I've been working in the HIV areas for over 30 years. And I've also been working for Indigenous people all of my life. I am Cree from Treaty 4, and I am here to speak and to listen to the truth and to develop those relationships that have to happen on this land for us as Indigenous people to move forward. We've heard over and over in this conference that Indigenous people have to lead, that we have to bring those solutions to life that need to be here on this land now as we move forward to address the many, many diseases that are here today. So I want to thank all of my national advocates that are sitting in the group here and sitting up here speaking and listening to what Canada will offer us today as we move forward to look for those solutions. And as we move forward, we need to work in unity to make sure that what we're doing is going to bring life to the people and the people that need the help and the support at the greatest. And the grassroots across this land, this movement, the HIV-AIDS movement has been active for over 40 years on this land. And today we're still looking for solutions and we're still wanting to work together and look for those solutions as we move forward. So I ask for that today, and I ask for each and every one of you that came here today to this conference that you would take back those blessings to your home communities and that we would ask and look and continue to work together in unity. Hi.
Thank you so much, Margaret. À ce moment, merci de prendre part à ce en avant au sujet de la lutte nationale contre le VIH. Aujourd'hui, nous entendrons les allocutions de l'honorable Jean-Yves Duclos, ministre de la Santé, le Dr. Harpreet Kochhar, président de l'Agence de la Santé publique du Canada, Ken Monteith, directeur général de l'organisme COXIDA, et Jody Jolimer, directeur général du Centre de recherche communautaire. À la suite des allocutions, nous allons prendre des questions des journalistes. Pour ceux qui se joignent à nous via Zoom, nous débattrons avec les questions ici dans la salle avant de passer aux questions sur Zoom. Pour ceux qui sont ici sur place, merci de bien vouloir vous rendre au micro pour poster votre question. To repeat in English, thank you to everyone for attending today's event about the domestic response to HIV. Today we'll hear remarks from the Honorable Jean-Yves Duclos, Minister of Health, Dr. Harpreet Kochhar, President of the Public Health Agency of Canada, Ken Monteith, Director General of COXIDA, and Jody Jolimer, the Director General of the Community-Based Research Center. After the remarks, we'll invite questions from the media. For those who are joining us on Zoom, we'll be starting the questions here in the room before we go to Zoom. And to begin, I'm pleased to turn it over to our first speaker, Ministre Duclos, à vous.
Merci beaucoup, Sean. Thank you, Margaret, for the beautiful and well appreciated opening remarks. Thank you also for your earlier presentation with the drumming group. Hello, Jody. Congratulations on your new appointment. To Katie. Hi, Harpreet, and hi, Ken. Nice to be here with you. Et je devrais souligner en partant que nous sommes sur le territoire traditionnel et non cédé des Taniennes Kalkehaka. C'est un endroit qui a été longtemps et continue d'être un lieu de rencontre et d'échange entre tous et toutes. I would also like to thank the HIV community whose voices help inform the HIV response at home and globally. We know that in our fight against AIDS, we must be guided by actual lived experience. And it is why we need to recognize those living with HIV in this very room today. Those loved ones we have lost through inaction, and those long-term survivors who continue to inform and shape our path forward. It is an honor for all of us, and for me certainly, to be here at the Canada Pavilion, where the remarkable work of community organizations is on full display as we commit to the theme of the pavilion: solidarity, science, and support. COVID-19 has obviously impacted our HIV response here and everywhere. Recent survey data from Canada has shown that the COVID-19 pandemic has negatively impacted the delivery of and access to services for sexually transmitted and blood-borne infections, including testing. Lessons learned through Canada's pandemic response provide new opportunities, however, for innovative approaches to reaching the undiagnosed in Canada and meeting new targets established for HIV. AIDS 2022 has given us the opportunity to reorganize our efforts to concentrate on what we must do to end the AIDS pandemic. Canada and the world is now focused on this goal. Malgré la COVID, notre gouvernement continue et continuera à agir dans la lutte contre le VIH, comme le démontre l'annonce du ministre David Lametti la semaine dernière. Notre gouvernement va lancer des consultations en octobre 2022 qui viseront à recueillir l'avis des intervenants et du public sur la meilleure façon de moderniser la réponse du système de justice pénale à la non-divulgation de la séropositivité, à la lumière des preuves scientifiques relatives au risque de transmission sexuelle du VIH. De plus, le ministre Sajjan a aussi annoncé hier un investissement de 15 millions de dollars pour UN-AIDS pour les aider à continuer leur travail et réunir l'industrie, la communauté, les partenaires gouvernementaux et tous ceux et celles dont on a besoin de la contribution pour fournir des soins qui sauvent des vies, incluant des traitements. Que ce soit à l'échelle nationale ou internationale, le gouvernement du Canada reste et restera toujours un allié indéfectible dans la lutte au sida. We know that HIV is preventable, yet the rates of HIV infections remain high in Canada and in other countries. Providing individuals with access to testing, treatment, and care can help reverse this trend. Removing barriers is the key to ending the AIDS pandemic. Through the pandemic, we've heard to innovate to reach people and connecting them to care. Now we are taking the lessons from this other pandemic and applying them to our own AIDS efforts. For example, Canada's National Microbiology Laboratory has been working closely with Indigenous communities in northern, remote, and isolated settings to equip them with the tools and training they need to be able to perform testing for infectious diseases. This has enabled a culturally responsive, community-led, and community-based response to healthcare in those communities, empowering them to determine their own path forward. And that holds so much potential for the HIV response. Aujourd'hui, notre gouvernement annonce qu'il va investir près de 18 millions de dollars pour étendre le dépistage du VIH aux communautés et aux populations difficiles à atteindre. De ce financement, 9,9 millions de dollars serviront à appuyer les travaux du Laboratoire national de microbiologie de Winnipeg afin que nous puissions atteindre encore plus de communautés, encore plus de gens. Ce financement permettra aussi l'achat d'équipements de diagnostic afin que des tests puissent être effectués dans ces communautés. Un autre 8 millions de dollars ira à des organismes communautaires pour rendre les trousses d'autodépistage du VIH plus accessibles. Et parlant de trousses d'autodépistage, en voilà une. Ces organisations font un travail remarquable pour nous aider à communiquer avec les personnes qui ont besoin de tests. La stigmatisation et la discrimination sont des obstacles aux soins et les trousses d'autodépistage du VIH offrent l'anonymat. Il est essentiel de fournir aux gens les méthodes de dépistage avec lesquelles ils se sentent à l'aise pour que, 1, ils connaissent leur état, 2, qu'ils aient accès à un traitement et que, 3, leur virus devienne indétectable. Nous savons que indétectable équivaut à intransmissible. Nous savons depuis, en fait, 2018, lorsque le Canada est devenu le premier pays au monde à appuyer cette science. I égale I, U equal U, est plus qu'un simple message qui change la donne. C'est un outil qui nous permet d'éliminer les nouvelles infections au VIH, réduire la stigmatisation liée au VIH et réduire les décès dus au sida. En conclusion, in Canada, we know that removing the barriers to care and ensuring everyone has equal access to HIV prevention, care, and support is key to reaching our shared goals of 95, 95, 95 by 2025, and ultimately ending HIV as a public health concern by 2030. It gives me hope to think of how far we have come. Today, HIV is a manageable condition when diagnosed and treated early. And with the evidence showing that antiretroviral treatment can prevent transmission to other people, there is even more reason to be optimistic. We have made real progress over the past 3 decades, and we won't stop now. One pandemic cannot overshadow another. Yes, we've come a long way since the 1980s, but we know that much more needs to be done. I hear you. The entire government of Canada hears you. I hear your anger and anxiety, and I also hear your hope. Hope that we can do better if we work together. That hope and hard work is what we want to focus on. Together, let us re-engage, follow the science, and carve the path towards a world without HIV/AIDS. Thank you. Merci.
Merci beaucoup, Ministre Duclos. Now I'll invite Dr. Koshar for his remarks.
Merci, Dr. Rook, pour cette introduction. C'est pour moi un grand plaisir d'être ici avec le ministre de la Santé aujourd'hui pour cette importante annonce en tant que président de l'Agence de la Santé publique du Canada. I'd like to first acknowledge that we are gathered today on the traditional territory of Kanigagan, a place which has long served as a site for meeting and also exchanging amongst the First Nations. And I say that with much pride that we all need to take a moment to acknowledge the land we are working from as well as where we are. I'm pleased to be here today among you with all people who are either living with HIV, the scientists, the researchers, advocates, and community organizations who are united in the pursuit of improving the lives of everyone living with and affected by HIV. As you heard the Minister, Health Canada made the historic decision in 2020 to authorize the first HIV self-test kit in Canada. That was a big feat. We know that many people experience barriers to accessing HIV testing because of stigma or fear of being discriminated against. Others face difficulties accessing testing because of where they live. Now, through further investments, as were mentioned earlier, to the community, the Public Health Agency of Canada will make HIV testing more widely available across Canada to key populations. This is an important step in reaching those who are undiagnosed and linking them to the care. A central pillar of Government of Canada's 5-year action plan on sexually transmitted and blood-borne infections is supporting innovation through community-based efforts, and community organizations in Canada have shown leadership. They have shown resilience, they have shown innovation and adaptability through the COVID-19 pandemic, and we are going to build on that. I'm very grateful for the tireless work of those of you here today and to others who are reaching people, connecting them to care, and continuing to do their best to ensure no one is left behind. And I had the opportunity to meet a few of the audience members here who are doing a phenomenal work in that aspect. Indigenous communities have demonstrated remarkable leadership in addressing these barriers throughout COVID-19 by adopting culturally appropriate community-led testing for infectious disease. Avec l'annonce d'aujourd'hui, le Laboratoire national de microbiologie de l'Agence de la santé publique du Canada continuera le travail avec ces communautés pour élargir le dépistage du VIH et d'autres types de maladies infectious. This testing close to home option is critical for equitable access to testing and for closing the gap in testing capacity in remote communities. Testing is the first step to getting people diagnosed, connecting them to treatment, and getting them to undetectable level. In Canada, we know undetectable equals untransmittable, and we will continue to spread this message widely. On July 28th, in front of World AIDS 2022, Canada proudly announced the support for the global call to action on undetectable is equal to untransmittable. Alors, merci encore à tous ceux qui sont ici aujourd'hui. Thank you for those living with HIV, those who have lost, and those who continue to shape this important work. We know that your contributions are invaluable to the HIV response, and I personally look forward to the continued collaboration as we continue to engage and follow the science. Thank you very much. Merci beaucoup. Miigwech.
Thank you very much, Dr. Kochar. And I'll turn it over to Ken Monteith for his comments.
Bonjour. Premièrement, je veux reconnaître que nous sommes sur le territoire, sur une place qui s'appelle Tiohtià:ke, sur les terres traditionnelles et non cédées des peuples Kanien'kehá:ka. Nous faisons ces reconnaissances parce que, après des décennies et des siècles de gouvernements qui ont poursuivi des politiques pour effacer la réalité autochtone, il nous revient d'affirmer et de célébrer la présence autochtone autour de nous et les terrains qui les appartiennent, sur lesquels nous vivons et nous travaillons. Pour l'annonce, nous sommes très heureux de l'annonce de ce financement ponctuel pour améliorer le score du Canada sur cet élément de la cascade des soins qui est le dépistage. Nous sommes aussi ravis de la reconnaissance du rôle incontournable des organismes communautaires pour rejoindre les personnes typiquement exclues. Il faut reconnaître cependant que le financement doit être pérennisé. Les structures communautaires qui soutiennent les actions doivent avoir un soutien en continu afin de pouvoir porter ces actions importantes. Il faut aussi élargir notre vision pour inclure les autres aspects de la cascade des soins et de reconnaître que partout sur cette cascade, il y a un rôle à poursuivre pour le gouvernement fédéral pour soutenir les communautés. Étant du Québec, je suis très conscient de la ligne entre le rôle fédéral et provincial. C'est dans notre sang ici, mais j'affirme qu'il y a des actions collectives pour arrimer les gens aux soins, pour soutenir à ce que les gens arrivent à contrôler la charge virale de leur VIH et qu'il y a un rôle pour le fédéral dans ce sens pour soutenir les actions communautaires. Il faut se rappeler aussi qu'avant la cascade traditionnelle de dépistage, arrimage aux soins et contrôle viral, il y a aussi la prévention. Et après cette cascade, il y a la qualité de vie de personnes vivant avec le VIH et les enjeux de stigmatisation. Au-delà des questions du financement, il y a des enjeux aussi qui doivent mobiliser d'autres ministères. Je parle de la criminalisation de la non-divulgation du statut de séropositivité que vous avez référé à Monsieur le ministre, et nous sommes contents qu'il y ait une consultation démarrée et espérons que ça mène à des solutions assez vite. Il y a aussi les enjeux de criminalisation du travail du sexe. Et il y a la guerre sur les drogues dans un contexte de crise de surdose. Ces choses sont des bâtons dans les roues de notre mouvement. Nous essayons de répondre aux besoins de nos communautés et la criminalisation à tous les niveaux nous empêche d'arriver et de protéger la santé de nos communautés. Vous trouverez dans les organismes communautaires et dans les communautés des personnes touchées, des partenaires prêts à s'asseoir et à planifier ensemble notre riposte au VIH. J'espère que nous pouvons poursuivre nos collaborations pour un Canada sans sida et sans transmission du VIH d'ici 2030. Merci.
Merci beaucoup, Ken. Over to you, Jody, for your comments.
Thanks, Sean. I'm grateful to be here in Tiohtià:ke, also known as Montreal, on the traditional lands of the Kanien'kehá:ka. I want to thank the ministers, Duclos and Bennett, and the Government of Canada for inviting me to comment on this important investment in HIV testing that will ensure more Canadians have the tools they need to access testing and know their HIV status. Ensuring that more Canadians know their HIV status is one of the most important actions we can take to end Canada's HIV epidemic. When someone knows their HIV status, they can access treatment and they can achieve an undetectable viral load, meaning they cannot pass on HIV to their partners, eliminating the risk of onward transmission and stopping HIV in its tracks. Undetectable equals untransmittable, and thank you. I'm so glad to hear that here on the stage today. Despite this, nearly 17,000 Canadians living with HIV don't know their HIV status. This is often due to barriers that undermine access to HIV testing, including stigma and discrimination faced by Indigenous, Black, and racialized communities, and two-spirit, gay, bisexual, and queer men. Our other barriers include access barriers for those living in rural and remote communities that make services like HIV testing too far or too difficult to reach. To end HIV as we know it, we must do better to ensure all Canadians have access to HIV testing, regardless of who they are or where they live. Expanding access to innovations like HIV self-testing will help mitigate these challenges and will put the power of knowing one's HIV status in their own hands. This will help us reach our goal of ensuring that all people living with HIV can access testing, know their status, get linked to treatment, and achieve an undetectable viral load. Over the past 2 years, our organization, Community-Based Research Center, has worked with partners across the country to develop and deliver a variety of HIV self-testing projects. We know that this work is effective. We know that communities want these tools, and we know that they'll use them. So we're grateful that the government is responding to this important need by placing the tools in the hands of the people that need them most and the community organizations who serve them. While this investment is welcome news, as we come to the end of the International AIDS Conference, we must reflect on the work that is left to do. Canada's action plan for STBBIs includes a comprehensive roadmap that will bring us closer to achieving our global targets, but only if we're able to execute it. While reaching the undiagnosed is an important component of this roadmap, on its own, it is not enough. Communities affected by HIV continue to face stigma and discrimination that put us at an elevated risk of HIV infection and acts as a barrier to testing, treatment, and care. Still, too many people at risk for HIV in Canada do not have access to prevention tools like pre-exposure prophylaxis. We must work together to rid society and our healthcare system of this stigma and ensure that communities affected by HIV have equal access to prevention, treatment, and care, equitable access. My apologies. We all deserve optimal health and well-being. This is how we will end Canada's HIV epidemic. Canada is home to a robust network of community, health, and human rights organizations who are best equipped to address stigma, enhance access to prevention, treatment, and care, and reach the undiagnosed through the expansion of innovations like self-testing. However, these organizations are often struggling to stretch their limited resources to cover the growing needs of the communities we serve. While increased access to testing technologies is key, the government must also increase funding to community-based organizations in the HIV sector to ensure we have sufficient resources to deploy these tools effectively and to ensure we reach those most in need. Today's announcement represents a meaningful investment in Canada's efforts to end the HIV epidemic. However, much more work and investment is needed. We look forward to working with the Government of Canada, the community HIV sector, and communities affected by HIV to secure further investment to achieve this goal once and for all. Thank you.
Thank you very much, Jody. And to all, merci beaucoup pour vos allocations. Nous allons maintenant prendre des questions des journalistes. Thank you for your remarks. We will now be taking questions from journalists. Marie-France, over to you.
Merci. Donc, merci tout le monde pour vos allocutions. On va débuter la période de questions avec les journalistes présents ici en salle. S'il vous plaît, vous dirigez d'un des deux côtés pour les microphones. Veuillez vous nommer, puis votre média aussi. Puis, s'il vous plaît, vous limitez à une question puisqu'on est plusieurs dans la salle. So we'll begin with the question period with media here in the room. Please limit yourself to one question since we are many. Please introduce yourself and your media.
Hi, I'm Sandra Wesley of Stella L'Ami de Mamie, an organization by and for sex workers, and I'm reporting, I guess, for a bulletin right now. The UNAIDS objectives, you've mentioned the 95, 95, 95, but they start with 10, 10, 10. And the first one is that by 2025, 90% of countries should have fully decriminalized sex work, drugs, non-disclosure, homosexuality, and anything else really that is criminalized in communities affected by HIV. So our perspective is that that's kind of the cost of entry now to be considered an ally in the fight against HIV. So is Canada on board with those objectives? And if so, what is the action plan in order to get to those objectives by 2025?
Thank you. I suspect the question is directed to me first, but it would be nice to hear other perspectives as well, because as we heard many times today, this is not only a plan, but a success which is due to and supported by community organizations of which you are a member. And I would like to first to say that, because I had the opportunity of meeting you just a moment ago at the Stella group, and
Perhaps I can add one point of information to help you answer this question. The Attorney General of Canada is currently fighting against us in court. Sex workers in the Canadian Alliance for Sex Work Law Reform are suing the government to have sex work laws declared unconstitutional, among other things, because they put us at risk of HIV, and that's a violation of our Section 7 rights. The government of Canada is currently fighting against us. So how will you achieve that objective of decriminalization by 2025 if you are actively fighting against it at the moment?
Yeah, well, that's very good. And thank you again for mentioning that. As you might expect, I'm not going to be meeting the expectations of your question because I'm not the Attorney General and I'm not the Minister of Justice either. But I know the sensitivity and the commitment of David Lametti, a colleague, obviously. And if he were here today, he would appreciate very much hearing what you just said. And I'll make sure that myself and the team that is listening does convey that to him directly. And maybe he could get back to you directly, which you probably would welcome. And if not, then he could use other purposes or other networks.
Thank you.
Monsieur Duclos, André Picard du Globe and Mail. Your government has refused entry to hundreds of delegates to this conference, denied them visas. What would you like to say to the organizers? They've called you out. People are angry here. What are you going to do about this? Are you going to apologize? Or...
Merci, Monsieur Picard. Merci, André. And not only do I understand that, but I hear that and feel that very much, very so, and very sincerely. There is a lot of anger regarding the way in which visa applications have been handled. And it needs to be recognized that this is not only a source of anger, of frustration, but also a source of inefficiency, if I can use this more bureaucratic language. No, we should be more numerous, more united, more present in this room and in the many other rooms of this conference. So it's a I wouldn't say a human tragedy, but it certainly is a tragedy, a collective tragedy that not more of us couldn't come to this particular place. I'll again signal that to my colleague in the government of Canada and express my personal and professional viewpoint that a conference of this size, nature, and value needs more people in the conference than were able to come.
Jacob Serban, Canadian Press. Ken and Jody, I spoke to you both last week, and you said you wanted to see the federal government put $20 million a year in additional funding for HIV response. I'm wondering what the two of you would like to see as a next step from Minister Duclos here. And Minister Duclos, what's your message to the people sitting on the stage with you to their call for this to become, not just this funding, but annual funding, an annual funding increase?
Do you want to start, Jody and Ken?
Sure. Well, thanks. Obviously, this was not what we were hoping for, but we recognize that HIV testing is a significant and important aspect of both the STBBI action plan, but also how we're going to get closer to ending the HIV epidemic in Canada. I view this as a first step. I'm encouraged by this. This is great. An investment in HIV testing will certainly help us get these test kits in the hands of people that need them, but we're hoping that this is an open door policy and that there'll be more conversations in the future around exactly how we want to spend that $20 million. Testing was one of those things. We want to be able to look at things like prevention, treatment, care. So Mr. Duclos will be calling.
And if I can add, I think that we expect that this is a good start that we expect to be sitting down to discuss how this rolls out and how the money is allocated. And we also hope that that will continue. And so, as I said in my opening remarks, that we will look at other parts of the cascade, and we will look at prevention, and we will look at quality of life of people living with HIV and stigma. And we will talk about what we can do to address those things and provide the ongoing support of the organizations that we expect to carry these actions.
And I would use your phrase, Jody, first step, because not only is it a first step to further and future funding, but it's also the first step to ending this epidemic. Now we've heard and we know that now testing and diagnosis are key to helping people and communities. And we also know that access to such testing and the other services that come after is more difficult in some communities. And it's true for indigenous communities, racialized communities, remote communities. So this is where, if I can use an economic term, the marginal returns are greatest in this particular case. So that's why we need, well, every community is important, but those communities where access is even more limited, that's where we should be investing even further and even faster, because that's where the returns, both individually and collectively, are the largest.
Hello, my name is Holger Wicht from Deutsche AIDS-Hilfe, a big German HIV organization and publishing house. And my question is, crucial for the success of a testing program is that individuals know that in case of a positive result, they have access to antiretroviral therapy. So how is the coverage rate in Canada right now? Does everyone have access to antiretrovirals in case of a positive result, and who's paying for this? Health insurance, or is it governmental programs, or how is it working here?
I will want to invite Jody and Ken to provide their own perspectives, but if I may start this time first, this is another example, another reason for which, unfortunately, fewer people want access to a test or a diagnosis because of stigma, discrimination, exclusion, fear, anxiety of knowing the result of the test or reasons for which people don't want to be tested. Now, sometimes people don't have access to a test, which is equally worse. But no, this is another reason that if you get tested and you end up being positive, then what happens? If you fear or feel that you won't be able to access the treatment that you need to protect yourself and your loved ones and your community, then it may be one more reason for which you don't really have the will or the ability to know about your status. So that's one more reason for which we need to make sure that everyone who is diagnosed gets the treatment and the services that the person needs.
But how's the situation now?
Yeah, if I might add, Canada is a patchwork of accessibility across the country. Each province and territory has its own system. For a long time, we were quite proud in Quebec of our medication insurance system. There are costs involved to it, so those can exclude people. And we also know that there are people who don't have status that gives them access to health coverage here. Our organization has currently a project which depends on the charitable actions of doctors who are willing to see patients for free, of a public health laboratory that is assuring the follow-up, and the generosity of pharmaceutical companies to provide their products for free. That isn't an answer. That isn't a solution. We really need to get to a place where everyone who is on the territory has medical care, complete medical care.
I still don't understand how many people already have access and how many don't.
Yeah. It's very hard to count the people who don't have access. I think it's one of the things when we look at our 90 results that Canada arrived in 2020 at 87% of people who were diagnosed having access, but those are the people who are officially in the system. So it's very hard to count the absent.
Thank you.
Bonjour, Normand Grondin, Télévision de Radio-Canada. Monsieur Duclos, avez-vous des objectifs concernant les tests d'autodépistage? Ça concerne combien de personnes seraient visées dans l'ensemble? Combien on souhaite rejoindre avec l'enveloppe que vous avez prévue? Parce qu'il y a quand même un nombre défini, j'imagine, de gens qui ne sont pas testés en ce moment.
Je vais laisser le président Harpreet donner des précisions additionnelles à celles que je vais donner dans un instant. Donc, il y a deux composantes majeures dans l'investissement d'aujourd'hui. La première composante, c'est un appui d'à peu près 8 millions de dollars à des organisations communautaires qui, comme on l'a entendu, sont extrêmement importantes. C'est ça qui fait la différence. C'est être sur le terrain avec les outils, l'expérience, mais surtout les contacts dont ces organismes profitent pour aller chercher les gens, les accueillir comme ils sont et pouvoir en prendre soin. Donc ça, c'est 8 millions de dollars pour faire exactement ce que Ken décrivait il y a un instant. Un autre 8 millions de dollars pour rejoindre les gens dans des communautés plus isolées, plus éloignées, plus marginalisées, en travail, en collaboration et en appui avec le laboratoire national de microbiologie. Il y a à peu près 50 communautés qui vont être appuyées par cet investissement qui va passer par le laboratoire. Maintenant, Harpreet, est-ce que vous pouvez nous donner une idée approximative de combien de gens là, on espère pouvoir traiter, tester?
Oui, sachant qu'il y a peut-être 2000 nouveaux porteurs de VIH par année, si je comprends bien. Donc,
c'est ça, il y a à peu près 63 000, 62 000 de gens que l'on sait être infectés. Il y en a à peu près, si on comprend bien les statistiques, à peu près 15% qui ne sont pas diagnostiqués, qui sont porteurs du VIH, et à peu près donc 2000 de plus par année qui sont testés positifs. Mais combien à peu près de plus là, on est capable de tester avec le financement d'aujourd'hui?
Merci pour la question. Et pour l'investissement avec le self-test, approximately what we will probably do is investment will be into the self-testing, which depending upon how the cost is, that right now there's only one company which is manufacturing the test. So as there are more companies coming in, we'll be able to reach more of those who are able to be tested. Recently, what our investments have been mostly are to make sure that there are test kits available for the community-based organization. The National Microbiology Laboratory also puts together a fundamental program which reaches very far northern, remote, and indigenous communities, which actually is our focal area also. And the provision of the self-test to them will also allow us to increase both reach as well as what we are achieving the goal of 95, 95, 95. So it's a multi-pronged approach. And I think the investments right now are focused on both the laboratory capacity, the self-testing capacity, the community-based organizations to be involved, and fundamentally making sure that that is leveraged further with the earlier investments which we've had in the community-based organization.
Est-ce qu'on sait le prix d'un seul test dans l'ensemble? Combien ça coûte pour une trousse pour un seul dépistage?
Oui, moi je sais. Donc, un seul trousse ça coûte 35 $ plus frais d'expédition. On peut en acheter 2 pour 55 plus frais d'expédition. Mais j'imagine qu'avec un achat en gros, le gouvernement fédéral va pouvoir négocier un meilleur prix.
Merci.
Just for the moment, just to jump in to acknowledge and welcome Dr. Carol Bennett, who's here with us. Thank you for joining us. Dr. Bennett is the Minister of Health and Addictions and Associate Minister of Health.
Thank you and welcome, Minister Bennett. This wraps up the question period in the room, so we'll now turn it over to Mark, who will take questions from reporters on Zoom. Mark, over to you.
Merci, Marie-France. Pour le Zoom, si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question. Sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. For the Zoom, if you're a reporter and wish to ask a question, please use the hand-raising function. We ask that you limit yourself to one question. Unless I have stated it, please indicate your name and media outlet before posing your question. Veuillez patienter, I'll just wait a few moments. Okay, our first question comes from Ashvin. I cannot see the surname, from the Observer Times in Mumbai.
Thank you for considering my question. My question is, what are the AIDS therapeutics impact factors you have achieved in past year in the Canada? Thank you.
Maybe I'll try. I think the question probably is basically how much is the effectiveness of the therapeutic which we are using, because we are using the antiretroviral therapy, and what we intend to do is to make sure that we calibrate the dose so that we can get to the undetectable levels. So that is individually used as a therapy for and customized for each person who is tested for that. If that is the question, I think that is probably what it is. However, in a way of calculating the therapeutic index, there is a bigger population which you would probably want to look at and see what are the different therapies which actually give you that calibrated pharmaceutical kind of average of that. So just basically tying it up, this is based on in an individual therapeutic plan, which is developed through the both the detection as well as based on what the intervention is from the physician.
Merci. Nous n'avons qu'une autre question. No other questions on the Zoom. Over to you, Marie-France.
Thank you, Mark. So before handing off the end of the conference to Dr. Rourke, just noting that our dignitaries will mark their way to the Canada Pavilion at the Health Box in a few minutes to take final pictures. So if anyone wants to attend, it's just for pictures. Thank you, Dr. Rourke.
Merci. Ceci conclut l'événement d'aujourd'hui. Merci encore une fois d'avoir été ici avec nous. That concludes today's event. Thank you for attending.
Recording stopped.